Today on Everyday Injustice, we have Emily Salisbury, who's the director of the Utah Criminal Justice Center. Welcome to our show.
Hi there. Thanks for having me on.
So, maybe start with a little bit of your background and how you ended up getting interested in working with women who are incarcerated.
Sure. Yeah. I'm an associate professor as well in a college of social work at the University of Utah. And I'm not trained as a social worker, but I am trained as a criminologist and have a master's degree in forensic psychology and then my PhDs in criminology and criminal justice. I really work in the area of the intersection of psychology and criminology or criminal justice. I think like a lot of people in this work, I had really good mentorship during my doctoral program where I was mentored by somebody who was doing quite a bit of work on behalf of and with justice involved women. And that's sort of what really sparked my interest in thinking about working specifically, with this population of women. Um, she at the time was working on a project, a federally funded project that focused on building out and creating really what is now the only risk, needs, and strengths assessment specifically designed by and for justice involved women. So I'm sure we can talk a little bit about what that instrument does and why it's necessary and why we need to do some things differently with justice involved women and meet them where they're at. But really, I had really strong mentorship. I was a lifelong student, right? I'm a university professor. I never left school. I get to go back every year. And it's really, I feel very fortunate to get to do what I do.
So let's start with justice involved women, because one of the things that I think we've kind of learned is that, they are the fastest growing group of system impacted people. And why is that actually the case? Let's start there.
Sure. Yeah. There's a number of different reasons, right, why the population of women has really grown. We've made public policy decisions in this country in the last 40 to 50 years that has really widened the net in the number of people who get swept up in our criminal legal system, right? People who end up getting incarcerated. And as we sort of think about widening that net, right? Like if we're thinking about a fishing net, so to speak, right? You're going to catch a lot more big fish of people that you and I might be scared of, right? In terms of the people that are committing crimes, but you're also going to get a lot of people who are the little fish, the people who, are involved in drug and property crimes, which is, not to suggest that those aren't serious crimes, but they're certainly not violent and a lot less likely actually to recidivate. So, as we have decided in this country to widen the net and increase incarceration strategies and to take a more incapacitative and deterrence and retributive approach to our correctional system, that has meant that more and more women have ended up in criminal justice settings and incarcerated settings. Much of that has to do with things like sentencing policies and strategies that are mandatory minimum sentencing guidelines, which I can talk more about if you'd like, determinant sentencing strategies, right? Like the ways in which we have gotten so-called tough on crime in the last 50 years has really been not just a war on economically poor individuals, but particularly economically poor, marginalized women of color.
And the needs for the women are different from men, which I guess at some level sounds obvious, but it's really not how the system has really operated for forever.
Yeah.
And so, from your perspective, tell us about what those needs are and why they're different.
Sure, yeah, and just to put a fine point on it, right? Just like many other institutions and systems in our society, right? Like education, public health. Criminal justice is no different. We start oftentimes, of course, with men in mind, and then apply policies and strategies and practices to women as if our bodies work and operate the same way, as if we see our world in the same way, as if, right, women's pathways to crime and reentry out of the system are the same. And so, right, I'm actually one of the founding scholars of this work of gender responsive strategies. A few criminologists came before me and really figuring out sort of an understanding and thinking through like how do women come to the criminal justice system and girls come to the system in different ways. And one of the things, well, one of the many things that we know is that even if some of the needs that men and women have sort of look the same on paper, right? Like substance use, an issue across, right, all genders. But when you pick apart the behavior, when you start to understand how women oftentimes end up addicted to substances or alcohol, uh, it looks different and oftentimes is related to numbing out pain from emotional or physical or sexual trauma. So the intersection between mental illness, trauma, and substance use looks really different for women in comparison to men. So all things that are important for all populations, but we know that girls and women suffer from disproportionately high rates of trauma in childhood, and that it manifests quite differently across gender, and particularly for women. So, right, when this is not this is a generalization, right? So it's not true for everybody, but important to sort of think about when boys are abused as children, awful as that is, right? The typical sort of scenario between the aggressor, the perpetrator, and the child is oftentimes in a somewhat adversarial sort of way. Not always the case, but we see that in the research literature. Maybe a father saying, "You're no good. I don't know why I even had you," right? Like really sort of adversarial, and oftentimes quite right aggressive. When girls are abused as children, either physically or sexually, right, it is oftentimes people saying to them, "I love you. This is what love looks like. This is how we show affection in our family." And those two differences, in conjunction with what we know about gender roles and how girls are socialized to be more dependent on other people and relationships in comparison to boys, where we foster independence, that sets oftentimes socially girls and boys in different directions and how trauma actually affects their lives. I could also talk briefly about there's quite a few brain researchers. I'm not one of them, but they do fascinating work that I'm learning from that says girls and boys who have PTSD, right? Like they both have post-traumatic stress disorder. One thing that we're seeing differently with girls is that there are different brain changes for them in comparison to boys. So there's a portion of the brain in girls that actually ages faster than what you see in the boys. And that part of the brain is responsible for emotional regulation. And so it's aging faster in order to be able to scan for threat, in order to be able to check the environment for potential threat due to evolutionary purposes, right? We're intended to procreate, right? To reproduce. That is what, the body is intending to do. And so that's so fascinating that's actually happening. And so girls are literally aging faster. Their brains are aging faster as a result of the horrific trauma that they have experienced. And so those are a few things. And then I'll also mention that girls and women have a need to connect with the relationships that we have in our lives in a very different way than what we see typically with boys and men. It doesn't mean that boys and men don't want to connect and have healthy relationships, right? But we know that girls are much more relational in nature. We see our worlds and our senses of self-efficacy as the kinds and qualities of relationships that we have with other people, including our families, friends, of course, and children if we have them. So I'll give you an example, right? Like sometimes when I'm delivering training, I'll ask, hey, David, how often are you worried about some dude, that you just met not really liking you? And usually somebody will say, right, like, it doesn't really bother me that much. That's his problem that he doesn't like me. For girls and women, right? And oftentimes we will take it internal. If somebody doesn't like us, we'll say, what did I not, right? Did I speak too much? Did I not compliment her enough? What did I do so that she didn't actually want to have a relationship with me? So that in and of itself alone is a sort of example of how women see their worlds. Another example of relationships being so crucial in driving both antisocial behavior with women and pro-social behavior, like motivating behavior. Anytime I walk into a women's prison and ask, like, okay, what are the kinds of misconducts or infractions that are going on in the facility with women? I mean, I can almost predict that like 90% of the misconducts are driven by unhealthy relationships in that particular facility. Somebody talking about my man, somebody, right, like gossiping about me in a way that was inappropriate. And so I had to get back at her, right? Like so much is wrapped up in unhealthy intimate relationships and unhealthy just social relationships.
Can
So
I cut
yeah,
in on
yeah,
that?
please. Yeah.
Um, because one of the interesting things I've noticed is like when I talk to men that are in prison, they have this saying that they always use, like, hurt people.
Yeah.
And what's kind of interesting, I think, about the women population is you see some of that, but a lot of it is hurt people hurting themselves.
Yeah, absolutely. So, one of the things that we really try to help in my work and some of the work that I do is really helping correctional executives understand that they do need to have different policies and practices and procedures for women. Is that the relationship with the self is the hardest work to work on, right? Like that's where the pain, shame, and guilt lives. That's where and I would say that's true, right, for both men and women, but the reactions to trauma and victimization, right, are very different too, right? As you're mentioning, girls and women have a tendency to go sort of inward with their trauma, right? Um, Self-harm, right? Eating disorders is another very sort of common way. Depression, anxiety, mood disorders that are not necessarily outwardly aggressive, but you have to really sort of see some of the internal dynamics that are going on with women. Yeah, absolutely.
So let me ask you, you created and you mentioned this, the women's risk needs assessment. And can you kind of talk about why that tool is unique and how it's kind of changed the way that women are assessed and then rehabilitated?
Yeah, absolutely. Thanks for asking about it. So, as I said earlier, it is one of the only like peer-reviewed, validated, which means it's just evidence-based, right? Risk and strength assessment specifically designed for women. And when we say that we started with women in mind. We looked at the research literature that understands that trauma is an incredibly powerful and potent risk factor for girls and women to end up in the criminal justice system. And so we are one of the few instruments to even measure trauma, right? We actually have trauma, right? Embedded in questions about trauma embedded in the interview intentionally in the middle, not the beginning, not at the end, because we're doing a trauma-informed interview as a process of the assessment. Most assessments are sort of meant to be like, I'm just on a fact-finding mission. The WRNA is a trauma-informed interview. It's trained as a conversation. It includes needs like unhealthy intimate relationships, which gets women in trouble all the time. It's one of the few assessments that also includes strengths, right? The fact that people, even if they've committed very serious crimes, everybody can bring to the table the different strengths and abilities that they do have, and to leverage that in case planning and treatment. So the intention of the WRNA is to identify what needs to get treated in programming, because what doesn't get identified or assessed will never get treated, will never get sort of programmed. And so for a very long time, right, in corrections, we've been very, very reluctant to have conversations about trauma and victimization because staff just didn't want to open the Pandora's box. They weren't clinicians. They didn't want to have those conversations. And quite frankly, women in particular are dying to talk about their trauma because it's driving so much of their behavior from the background, right, underneath the surface.
In your view, and I'm going to ask this question like this intentionally, is the prison really the right place for this healing to occur?
It's a great question, and I often sort of debate it myself in my mind and in the work that I do. Look, we have to understand that prison environments are for some people their homes. It's where they live, right? And so, do we want to have better conditions for incarcerated settings, right? I'm of the opinion that we should try to do the best that we can to have humane, trauma-informed environments that speak to the needs that the population has, right? And I've seen it work. I've seen it be effective in terms of, right, like working on a therapeutic community, for instance, in a Department of Corrections that totally changed the environment from a TC, a therapeutic community, to more of an empowerment community with justice-involved women, where they actually could do really significant work on their trauma. I think also incarcerated women, when they're in that environment, if it's a safe environment, emotionally and physically safe environment that's facilitated well, they don't have the noise and the difficulties of what's going on outside, and they can start to do the hard internal work, right? But it does take the right conditions. Now, I'll also say it's incredibly difficult to sustain those conditions inside a prison environment, right? So even though I have seen these spaces operate and work well, it takes an incredible amount of intentionality. It takes prison officials and staff and executives who dare to care about this population in a different kind of way. The implementation of these sorts of sort of gender responsive and trauma responsive strategies takes significant courage on the part of executives because they're proposing to do something different for a smaller population that is not driving the budget of their correctional fiscal responsibilities, right? So I hear you when you ask that question. I oftentimes, sort of wonder it myself. At the end of the day, we've got to be doing things to keep women out of these environments and continue to do the work of early intervention, particularly for children, right? Unfortunately, we're not a prevention-oriented society, but that doesn't mean we stop continuing to do the work.
And just to be clear, I definitely agree with that last part. Where I'm headed with my question, I think, is that there are several layers to the prison issue. One is I have increasingly in my work come to the conclusion that most people don't need to be locked into a cage in order to get themselves righted. They may need to be removed from their environment, which I think is where you were going with that. And I'm still reminded of the vast difference between the US penal system and, say, Sweden, where instead of locking people in cages, they put them into dorms. And it's like a college experience, and they can even go out and work. But at least they're kind of away from the environment that led them into that problem in the first place. And that may be a much better solution. The other problem, of course, is what we've seen at places like Dublin, where the environment that women are put in actually reinforces all of the victimization and trauma that they've had, because they end up going, and in women's prisons, the most dangerous people are the correctional officers.
I take your point at that really well, and I just want to say thank you for saying it. It doesn't mean that every correctional officer and staff have nefarious purposes in any way, shape, or form. Most people do their job with
Of
professionalism as they
course,
speak. But all of the discussion about the chaos and the moral panic about transgender men ending up in women's prisons, honestly, we should be more worried about the staff.
it's funny you say that, because I was arguing that very point to a woman who is locally on the rampage against transgender people. And I say, look, I know a lot of transgender people and they actually keep themselves in male prisons, but um, but a lot might want to be in a woman's prison because they'd be safer, but they don't want to rock the boat. But but really, those people aren't a threat to women.
Yeah.
Um,
Yeah. And there are safeguards in place for people who
also,
self-identify and who are serial rapists trying to get access to victims. This does happen. I don't dispute that that does happen, but there are safeguards in place that departments of corrections have been handling for decades around this issue.
for sure. And I wasn't really wanting to go there, but I'm glad we mentioned it. But I've really become an abolitionist in terms of prison. And I'm not naive. I don't think we could, like, you know, end prisons and let everybody out today. That would not be helpful for anyone. But I do believe that we incarcerate way too many people. There are so many people I work with who are incarcerated who don't need to be there anymore. There are people, frankly, that do. And I'm not naive to that, and I understand. But I also think that, as I was mentioning before, that the prison environment itself creates more problems that it actually solves in that respect, because you, like, socialize people to do really odd things. One of the interesting stories about Sweden was they brought over all these American criminologists and prison guards
Yeah, a
and
lot to Norway too. Yep.
yeah, and Norway, and they see these dorms, and they're like, hey, there are forks and knives here. Does anyone, like, stab somebody with a fork and knife? And the person there goes, why would they do that? And if you think about it, like, think about the worst person you can think of. Like, when they're in their own kitchen in their home, you think they're, like, reaching over and stabbing their mom. I mean, no, they don't do that. They
Yeah.
do it in prison. There's a reason why they do it in prison.
Right. Exactly. And, you know, when you give people certain privileges and rights and normalize, right, they begin to police it themselves, right? They don't want to end up in a place and in a situation, in an environment where there aren't beanbag chairs in a facility because somebody's worried about they're going to, have a weapon in the beanbag, right? Like, I've trained in many other countries, in Singapore, the Czech Republic, right, Namibia, and it is very interesting to sort of see how different countries, um, organize their penal systems and the kinds of rights and privileges that they will give where we don't, right? It's incredibly interesting to see. Yeah.
Um, so in terms of your current work, what are some of the more promising things that you've seen maybe in the last 5 or 10 years?
Yeah, so I used to have to advertise the WARNA quite a bit, but agencies are now really coming to me quite a bit to get access to the instrument because they are understanding that gender responsive practices, where we start with women in mind, really are quite effective. One of the things that I'm excited about in terms of a project that we're working on is doing a randomized control trial of gender responsive probation supervision with justice involved women in 2 different counties that essentially is right comparing the gender responsive probation supervision to traditional probation with women, knowing full well that, right, like we may find some interesting things there, but a lot of agencies have started to embrace this type of supervision with women. And I think that's wonderful because I'm one of those right people who believes in it, but I'm also a scientist and want to see the data and evidence and make sure that we're not doing things that are not evidence-based and that we're not necessarily surveilling women more than we really need to be. Because to your point, right, like the vast majority of people who are incarcerated, and I will say this is especially true for women, do not need to be there. They can be successfully supervised in the community. So, because we have this staffing crisis as well in the prison system, I think it's crucially important to think about how we bolster community corrections in appropriate ways, and of course, early intervention before we even get to that point. So, I'm excited about that project.
And then finally, what what would you like people that are listening or watching this to kind of take away from this? Most people don't interact with system involved people, and so it's kind of this black box that's a little bit scary. And my experience has been better. Like I get to interact with people, and I understand I'm interacting with people that are probably in better shape than others, but still, at the end of the day, you're dealing with a lot of people. A lot of people really need treatment and help more than they need punishment. What is your kind of take home message?
You know, if listeners remember one thing, it's just that women pose far less risk to society in criminal justice, right? In committing crimes than men. We have to understand that women are far less likely to be dangerous, far less likely to be lethal, right? I just recently wrote an op-ed on the Wisconsin school shooter, right? That despite the amount of trauma that many, many girls and women have experienced, they actually are far less likely to be lethal and commit crimes, which is pretty important to understand and know that that's one of the iron laws of criminal justice.
All right. Well, we'll leave it with that. Emily Salisbury, thanks for coming on and sharing your experience with us.
Hey, I'm so glad you invited me. Thank you.
We've been talking with Emily Salisbury. She is the director of the Utah Criminal Justice Center. She works with system involved women. I'm David Greenwald. This has been Everyday Injustice. Join us again next week for more tales from the injustice system.